What we're talking about here is what medication to administer someone who is experiencing CPR-induced consciousness, which is when someone in cardiac arrest becomes conscious during chest compressions, something that we're seeing a lot more of with the wide deployment of mechanical CPR. This is incredibly traumatic to the person who is experiencing this, and so we want to give them something that will dissociate them from that experience, and ketamine is a perfect choice in this regard because it causes dissociation and is hemodynamically stable. Ketamine does cause an initial sympathetic bump. However, we're not overly concerned about that in cardiac arrest. In fact, theoretically, that could actually work with our efforts. Morphine, however, would be a terrible choice. Morphine causes a histamine release, and then histamine release causes peripheral vasodilation, which works against our efforts to get more blood to the heart. Morphine also is just an analgesic. It doesn't cause any sort of dissociation. So while the patient may not be feeling the pain of the chest compressions as much as they were before, they're still experiencing all the trauma. Some services do use Versed in this situation. However, I think that decision is driven more by the fact that they're not carrying ketamine more than they think that Versed is a better choice. Ketamine is emerging as one of the most popular choices in this situation, with dosages ranging from 0.5 to 1 milligram per kilogram IV. Follow your local protocols.